Hello, lovely learners. Welcome back to A Life Learned. So, this is certainly a video I never really expected to be making, but what is life except a series of unexpected events with a few planned ones in between? So anyway, long story short, I found myself pregnant a couple weeks ago, and it was not intentional at all, and I had no intentions of keeping it because of a lot of different reasons. But as we know, we shouldn't have to explain ourselves. The point is, it's my body and my choice. And so I got to have the experience of going through the local abortion clinic. And I thought it might be helpful to share that experience and the things I learned from it with anyone who might be going through a similar experience. So if you're in the London, Ontario area, the clinic that I looked up was just a local hospital, so that's the London Health Sciences Centre, and they call their abortion clinic the Pregnancy Options Clinic, which I think is a bit questionable personally, but maybe that makes some people more comfortable with the concept. I'm not sure. Point is, that's what it's called, so if you're ever looking it up, that's what you need to look for, Pregnancy Options Clinic. Right now they're booking upwards of 2 weeks in advance because I guess there's just a lot going on with people needing those services. And so, and then there's also the fact that our hospitals are seriously backed up in all areas because we don't have enough staffing. So that probably has a lot to do with it. But anyway, that meant that I actually didn't have an appointment until next week, but they said that I could call in every day. I figured it was best to call in the morning, and you basically can just leave your name and say, I would like to be called if there's any cancellations. And I kind of don't get why they don't have like a cancellation list you can just put your name on, but they don't. You have to call in every day. Point is that I did that a few times. I did forget for a bit, but then I did, and I managed to get an appointment for last week. And I was very relieved because it was my reading week, my week off from school. So, a little bit more convenient to be doing something or dealing with something like that than when I'm in the middle of school. So I went in. I was very apprehensive and stressed out. I was worried about all the different things that you hear about how awful it can be. There is a bylaw in London, though, that anyone who's picketing can't come within like 50 meters or like anywhere within the entrance of those locations, though, so that was not an issue at all. It was just walking into the hospital. The interesting and kind of weird thing, though, is I was going up to the same floor as everyone else goes when they're pregnant and just getting checkups and stuff. And the first part of the whole procedure or experience is to get an ultrasound to confirm that you are indeed pregnant, which means that you get to sit beside people who are very pregnant and intending to have babies. And something that the nurse pointed out to me that this is genuinely problematic with is that there are women who end up having to get an abortion because of a stillbirth, and they wanted the baby, but they can't have it. It's dead, basically, in their womb, and they just have to pass it. That's still a very similar procedure when you get a medical procedure abortion. And so they still have to go through the ultrasound too. They still have to sit in that room beside women who are actively pregnant with a live birth. And I can only imagine the emotional trauma that can put someone through. I certainly felt awkward and uncomfortable in the sense that I was like, I feel like I am a negative energy towards people who are trying to have a successful child. And, by all means, teach their own, go have your child. It's just, I don't want this. So it felt contradictory and a bit odd in that sense. And then the worst part was just the day before or 2 days before, had I helped her? I think it was one of the times I helped my friend get to the hospital because she's pregnant and has been having a lot of nausea. She has had what's called HG. I can't remember what the acronym stands for, but it means you throw up a lot when you're pregnant. She actually just had her baby yesterday. But the interesting thing was she was sitting there waiting for an ultrasound when I got walked through to go do my ultrasound. So it was just like, oh, hey. And she was very confused, and I just said, I'll explain later. But then the nurse actually ended up saying to her, like, oh, did you know your friend was pregnant? And so it was just like, oh, okay, well, so much for me explaining. So that was a whole thing, and it's been also an experience that I'm like, this beautiful little girl was just born, and I'm so excited to be a part of her life, but she was born the same night that I was aborting, and so that's just like a weird memory association. But anyway, so the big things that I think are really helpful to know if you're going in to get this procedure yourself, other than that at first initial trauma of the ultrasound, is they need your blood type in order to give you the medicine, because there are two options for abortion. You can get a medicinal abortion if it's under 10 weeks, or if it's over 10 weeks, you have to get the medical one, where they like procedurally go in and remove it. But you can actually get that under 10 weeks as well, apparently. I had the option of either or. And not to be too heartless about it, but they said it's basically just like going up there with a vacuum. So I thought that was kind of interesting. But there's a lot of catches to the procedure in the sense that you needed someone to come pick you up or to be available at your home to help care for you, and I just am not feeling comfortable asking anyone to do that. So I was like, well, we'll just do the medicine. Like, we're under 10 weeks. Let's just get that dealt with. If it's just a matter of taking a pill and having a period, then let's do that. But they can't give you the medication until they know your blood type, because if you're Rh negative, you can have a pretty adverse effects if you don't take a medication before taking the abortion medications. So there's like a pre-medication to abortion for Rh negative people. I knew I was Rh positive, but I didn't have my blood donor card on me, and they didn't have it on record. So I had to wait a whole nother day for them to like confirm my blood type, and then I was able to get the medication to start. So that was frustrating and inconvenient. But I figured it out. It just basically meant that I took the medication later in the day and basically aborted through the night. And whew, I mean, I don't know if it was better or worse that it was during the day or the night, but I wouldn't have minded if it was a day earlier, just so that it wasn't the same night that my friend's baby was born. It is what it is. But yeah, so what's something else I wanted to, something else that to keep in mind. I had thought to not really tell anyone. Then it started coming up here and there, just like I made a post that was alluding to the fact that I couldn't get the appointment sooner, and then people started asking about that, so I just was like, whatever, I'm getting an abortion. So like people knew, but I didn't really plan on telling anyone because I didn't think it mattered. But they were kind of insistent. They asked several times during their like little paperwork thing if I had told anyone, and they wanted a name to put down. I think because of like, well, liability regarding your mental health. They can't just let you go without knowing that you have some kind of emotional support, because for some people it can be a very emotional experience, especially if they had any conflicting feelings. I certainly didn't. I was 100% no questions, just did not want anything to do with the situation. It was not the right time, it was not the right person, it was so unexpected, and just so, no, not happening. Not the right anything. So thank God for healthcare in that sense. But yeah, even if you're not wanting to tell anyone, just have someone to be able to tell them that you told, and that you can put their name down that you told, because they want you to have at least one person that you can rely on. Main pointers for when you're going through it, if you do get the medicine. First things first, anything I share about my personal experience could be different from yours, because we all have different biology, and they do say that in the paperwork that it could be different. Like there's a range of times and pains and experiences. But for me, basically, so you take the first medication and it stops the hormones from like allowing the fetus to grow. And then you take the second medication the night you're going to abort, and that actually causes the uterus to contract and push the fetus out and abort. And so that's actually basically a period. Like that's what your period's doing when it doesn't get fertilized. So it's a forced period in that sense. And for me, that's kind of how it started. It was like, you know, just a bit of blood and then a bit of cramping and then a bit more cramping, and then it got to like the worst cramping I've ever had for a period, and I was like, okay, well, this is the worst I've ever had it. Like my first period was awful, but this isn't so bad if it's my worst period. But then it got worse. And I don't like T3s. They make me really sick and really dizzy, so I was avoiding them. But it got to the point that I was like, I need that T3. And even after that, I was kind of yelling at points because it was so painful. Maybe I should have taken another T3, but I lost track of time because I was too busy being in pain. I tried to lay down because I was exhausted, but every time I laid down, that made it worse. It was like, you know, I was peaking at a 10, but if I laid down, it went up to 11, if that was even possible, in terms of, you know, 10 out of 10 pain. And so I found, interestingly, that walking around and pacing kind of would bring it down to like a 9. So, you know, not the actual literal worst, but you're nearly there. So if you could have support during that time, just to have someone to remind you to take the T3 again might be helpful. Because that was, I guess, my only thing was I just didn't think to take the meds again, and that's probably why I was in pain for so long. But that eased up after, I want to say that went on for 3 hours, 3 or 4 hours. It wasn't too long on the grand scheme of things. But then I got the news, or rather just before that I had gotten the news that my friend's water broke, and I was just like, damn it, timing, because I had fully intended on helping get them to the hospital with my car. And I couldn't do that because I was in the middle of an abortion. And you can't drive when you're in that much pain. It's just not advisable. Nor when you're bleeding that much, to be honest. It's just not advisable. You know, physical exertion, not good. So yeah, definitely do it at a time when you can relax, as is said in the instructions and stuff. And as for after, so like all of this was happening over Friday night. So I'm on like, it's 40 hours since I started the whole thing. I don't know, something like that. And I'm gonna say that it bled pretty heavily from like when it started getting bad to this morning. So like 30 hours. And now it's like tapered off to my usual periods when I'm on the pill, which is like drip, drip, drip. So not much, honestly. But it is still coming out a little, which is inconvenient, but it's a lot better is the point. And the pain's gone mostly, like there's been a few little tiny cramps here and there, but other than that, it's mostly just been like a period at this point. So yeah. If you have any questions, please feel free to share them below. If you have a similar experience or you know someone who has a similar experience, also feel free to share below. If you want to go on about Roe versus Wade, I'm all for that conversation, but not if you're going to be anti-abortion, because I'm not here to be bashed. So you will be marked as spam and probably deleted if you're going to try and, like, you know, Christianize this conversation or make it anything about your beliefs, because you know, we all have our own personal beliefs and we're allowed to have them. What we're not allowed to do is force them on other people. It's just really that simple. But yeah, I'm here if you want to have a conversation. Please, as always, share your thoughts below and join me again next week or sometime soon, where I try again to share a little something I've learned or experienced in life.